Well, it's wonderful to be here with all of you, in particular, your future Congressman, Rudy Salas, Assembly member, to be back with you. Extraordinary contributions that are being made throughout the Central Valley with Clinica's extraordinary work. 24 sites, not dissimilar to this, all throughout the Valley, the backbone of our healthcare delivery system, and of course, the one, the only, the great Dolores Huerta. That's about as good as it always gets. And so I'm humbled and deeply grateful. Dolores, you took the time to be here. Unsurprisingly, though, you are here because we're here to advance a cause that you've championed for quite literally decades. We talk about healthcare for all. We have politicians of all political stripes over the course of decades preach the principle. We have standing ovations and audiences large and small. A principle is advanced. Elections come, go. Politicians come and go. Years become decades. In decades, we've seen inaction. Finally, we're at a point where we're making those words real. We are implementing our ideals. We are manifesting this principle, this fundamental notion that so many of us have been preaching for years and years and years. And here in the largest state in our union, in the state of California, we are positioned with this budget to be able to deliver on what we've been promoting: universal health care for all, regardless of pre-existing condition, regardless of the ability to pay, and regardless of your immigration status. We believe in this principle. We believe in the right to quality health care. We believe we are strengthened as a community. We also believe that families are strengthened, particularly in a state as diverse and large as the state of California, with so many mixed status families, with children themselves that may have health care, but a working mom that just got a mammogram and it didn't turn out as well as she had hoped, and now she is suffering the consequences of early diagnosis of breast cancer, and yet she, at just 35 years old, does not have access to health care. What that does to that young child, what that does to the family, the impact that has on the community, our economy, is profound and pronounced. And so we're here in that spirit to reconcile that, to strengthen our families, to strengthen our community, to strengthen the economy here in the state of California. For those, it's like clockwork, that are critical of this proposal, I would only offer this. We have universal health care in this state and in this country, but it's on the back end. It's called the emergency room, and it's costing you, the taxpayer, a fortune. If you care not just about values and principles of morality, but if your only values and principles are advanced through economics, then that alone should be an argument in favor of universal health care. Why not invest in treating people, in preventing the most acute conditions that tend to manifest on the back end, and as taxpayers be out of pocket as a consequence of that? Why not get that as we struggle through the latest surge of this pandemic? Why not get that preventative vaccine at extraordinarily low cost because you're covered, then wait for the ravages of the disease on the back end, where we end up paying for that uncompensated care, all of us, not just as it relates to counties and general funds, but all of us that have private health insurance who have higher premiums as a consequence. So this is about saving money. This is about strengthening families, and as I said, strengthening communities and the economy here in the state of California, and it's about time. It is a point of deep pride, not just principle, that we're here, in particular in the Central Valley, where we come back over and over and over again to make the point that this state is for all Californians. And one of the most dynamic and vibrant parts of California is represented not just here in Lamont, but throughout this region and the fastest growing part of the state of California. And we look forward to working with the legislature, with Assemblymember Salas and his colleagues over the course of the next many months. Senator Durazo and Rambulo have been credible champions of these principles over the course of the last number of years to get this job done and begin this process anew by the end of this calendar year, where the first cohort will be expanded for those, as Dolores said, that currently are without that health insurance. Happy to answer, of course, any questions on costs, any questions about next steps, but we presented yesterday a fully balanced budget in the state of California. We're enjoying record surpluses, record reserves, paying down a record amount of unfunded health care liability. We're being wise with our investments, looking at one-time surpluses and one-time investments. At the same time, we're not neglecting people in the state that are vulnerable, people that are struggling, and this is one of our top priority investments, not by any stretch the only investment in the healthcare space. We've expanded coverage to the middle class, and we're looking at affordability and price reductions in particular with high-cost pharmaceuticals. Everybody we had in mind this year as it relates to our healthcare investments. But when we talk about everybody, we're going to be inclusive to the 2+ million Californians that are working every single day, 10% of the workforce in the state of California, of which the vast majority have lived in this state for over a decade. And those are people, regardless of their immigration status, that pay billions of dollars a year in taxes each and every year in the state of California. And so I'm proud to be here. We promoted this 3+ years ago on the trail, and here we are 3 years later, and we have the prospect to do something historic and meaningful, and we hope to see this replicated all across the country.